Terri Sewell gives out major grants in Selma, a nonprofit leader loses her house to a fire, and UAB talks about their Doc on the Spot clinic. That and more in this week's edition of the Selma Sun Spotlight, Selma Dallas County's only local newscast. I'm Cindy Fisher, publisher of the Selma Sun.
And I'm Todd Prater, staff writer for the Selma Sun. Here's this week's top stories.
U.S. Representative Terri Sewell hosted 4 press conferences on October 6th and 7th, announcing major funding from the National Park Service to preserve civil rights sites in Selma region and enhance public safety. The grants were for Selma University, the historic Brown Chapel AME Church, and the historic Tabernacle Baptist Church. These investments are part of a $3.6 million funding that she helped secure from the NPS Historic Preservation Fund to preserve his civil rights sites in Alabama, and from $2.5 million that she helped secure to preserve historic structures on the campuses of Alabama's historically black colleges and universities. The fourth press conference on October 7th included Terri Sewell, Selma Mayor James Perkins Jr., and Selma Police Chief Kenta Fulford, and it was announcing major federal funding that she secured to bolster public safety in the city of Selma. The funds will be used to hire additional law enforcement and patrol the city to work to combat gun violence. It will also help facilitate an open relationship between the police department and the community through education and training.
Thank you very much for the support you provide, both directly and indirectly. I don't think that the citizens of our community really know the kind of respect you have earned in Washington.
On the second Friday of each month, medical staff from UAB Selma see patients without health insurance at 5 Points Community Development Center in Orville. The clinic is called Doc on the Spot, and it's a partnership between the United Way, UAB Family Medicine Selma, and Building Healthy Communities, which is a health initiative of UAB. Brenda Collins oversees the clinic and says that they do complete lab work, and what they can't do at the clinic, they send out. They even help patients with travel if the patients need it. Doctors screen for high blood pressure, diabetes, cholesterol, and a battery of other tests. Patients can even get x-rays for free. Anyone from Dallas, Perry, and surrounding areas who have no insurance are welcome to come to the Doc on the Spot clinic. That's every second Friday of the month, 10 a.m. to noon. Collins says if anyone without insurance wants to see the clinic or wants to come to the clinic, the first thing they need to do is call her at 334-996-0830. Imagine coming home after going to the movies with your family to find your home completely engulfed in fire and burning to the ground. You now have only the clothes on your back. This actually happened to a family here in Selma, the Lewis family, and it happened Saturday, October 1st. Cindy has more.
Brian and LaQuinna Lewis pulled up to their home at 230 Franklin Street in Selma after being out with their 4 children to find it burning. LaQuinna says they literally watched the second floor fall into the first floor. Ironically, LaQuinna is founder of Love Is What Love Does, which is a nonprofit that serves the poverty-stricken communities and disadvantaged people in Dallas, Perry, and other Black Belt counties. Now she finds herself on the other side in need of a home and replacement of basic items. Friends have begun taking donations of items and money. The Lewises need a place to live, and they need 3 nebulizers for her kids, and insurance will only replace 1. Clothing is needed as well. If you can help the Lewis family, please contact her at 334-553-4239. Thank you for joining us for this week's edition of the Selma Sun Spotlight. Read these stories and more at selmasun.com and follow and subscribe to us at our YouTube channel and on Facebook and Instagram and TikTok.
We'll see you next week.
See you next week.
Welcome. I'm Kishay Dozier-Smith, CEO of the Rural Health Medical Program. The Rural Health Medical Program has been a beacon in the state of Alabama for over 40 plus years. We are one of 17 community health centers across the state. We sit across 6 counties in the Black Belt region of Alabama. We provide preventative and primary healthcare services to all individuals, regardless of their ability to pay. Insured, uninsured, Rural Health provides a way for individuals to receive quality and affordable healthcare services. Over these 40 years, the Rural Health Medical Program has touched over 10,000 patients consistently in its history in providing affordable and primary healthcare services. Our organization also calls on leaders in the communities that we serve to join our voluntary board to lead and guide myself as the CEO and the other administrative leaders on how do we meet the needs of individuals in the community. It is through their leadership, their advocacy, that we're able to continue to meet the needs of the community members across the Black Belt region of Alabama.
After about 10 years of working at the local hospital, I felt that it was time for a change. So rural health to me was just kind of a natural progression. I feel like it's a calling and that God has placed me here. He answered a prayer when He brought me here. And I am so tremendously blessed and just extremely grateful for the opportunity to work with such a great group of people.
Coming from Nigeria, from a place with also limited resources, I came over to Selma and realized that there's that need for that help and services here as well. And if we can do, and that we can do more even with the limited resources available in Selma.
For more information on how you can become a member of our team or to receive services from the Rural Health Medical Program, give us a call at 844-736-7629 or follow us on social media or visit our website at www.rhmpi.com.